Tired of dealing with vein disease? Have your symptoms gotten worse?
Oh, these spider veins are ugly.
My legs and ankles are always swollen.
My legs are tired of standing all day.
While some symptoms can be managed by lifestyle changes, other factors are out of your control. Get help from the experts at Vein Clinics of Hawaii. To learn more about your treatment options, call 427-5565 or visit veinclinicsofhawaii.com. Aloha, Hawaii! It's time for the Vein Clinics of Hawaii radio show. Their team's approach to diagnosing problems and developing solutions and treatment plans are beyond compare. So let's get started with your host of the show, Mike Buck, and medical director, Dr. Randall Juliff of the Vein Clinics of Hawaii.
Well, here you are again. We're certainly glad to have you back with us. And you're in for a special treat today. You know, we've been doing the show for quite a while now, a little over a year. And the departures that I like the most are when we can get folks in here that are patients of the clinic. And like I said in many, many previous programs, a lot goes on at the clinic besides just plain vein surgery. I mean, there's fun stuff, there's cosmetic stuff, there's health stuff, there's a lot of stuff. And, you know, as you know, not only am I the facilitator, the host of the show, but I'm a patient. And I love it when we get other patients in because, you know, from time to time when I go into the office to have a treatment or a procedure done, I meet other people. And it's really interesting what an eclectic group of people. I usually go to veinclinicsofhawaii.com and then come in and see Doc and see the staff and get a few things done. We're going to talk today to a gal who, as a profession, is on her feet all the time. And, you know, when you're standing up and things aren't all so good, your job can be not too fun. Before we actually introduce our guest, Doc, one of the main things I know that when people come in for vein issues, that symptoms are very, very important. And there are all different kinds of pain, right? And so when we talk to our guest here in a minute, we're talking about somebody that had pain as a symptom. Didn't know what it was, but just pain in the legs. Common?
Right. Yeah, it is.
Yeah.
And that's one of the big problems with respect to people getting to us. You know, they have complaints about their legs that often are not immediately obvious that it has to do with their circulation or more specifically about their veins. And yeah, you're right. There's a whole host of different types of symptoms. Even looking at pain, there's a whole host of different types of pain that people might be experiencing. So a big part of our job is to, be able to teach people and spread that knowledge so that people are able to figure it out.
In some respects, would you say pain's a good thing?
Pain is
a good thing because it calls attention to a problem, doesn't it?
Absolutely. Absolutely.
And incidentally, and the reason why I think this is sort of ironic is that we know that a lot of the things that are used by the doc have been developed in Europe. As a matter of fact, the compression stockings that most of us wear came originally out of Germany. And it's funny because here we have a patient from Germany who, when she was in Germany, probably didn't have compression stockings, but maybe in Hawaii does have. And so I think that it's rather interesting. You're going to meet Sylvia, and Sylvia is a patient of Vein Clinics of Hawaii, just like me, but unlike me, and she went there for a completely different reason, and part of that was pain. Well, we certainly are appreciative of the fact that you're willing, Sylvia, to come in and talk with us and share your story. So you're from Germany.
That's right, yeah.
And what part of Germany?
Near Berlin.
And how long have you been out of Germany?
Now for almost 2 years.
And where did you get to speak your beautiful English?
From school, of course.
Okay, typically speaking, the kids in your class and people you went to school with, did they speak several languages?
Yeah. French,
I mean,
Russian.
Yeah. Mm-hmm. And you speak how many languages?
Oh, a little bit Russian, a little bit French.
Yeah. And a little bit English and a little bit. Isn't it kind of neat, Doc? Because here in America, most of us don't have a second language.
Yeah, it's probably a shortcoming of ours because, different languages also give you an insight into, other cultures and I think having a broader idea about the world as a whole is probably a good thing.
Well, Sylvia, you're certainly in the right place because you're in the hospitality business, right? And what sort? And I think when we were talking off the air, folks, before we got started, from what I understand, you did a lot of work on cruise ships.
Yeah, on a cruise ship around the world, and on a river cruise ship. And then, on a lot of different hotels.
Well, what are things like on a cruise ship for health issues? If you have pain or if you're sick on a cruise boat, I mean, I would imagine all the good ones have doctors on them, and they must have little clinicals on them. Did you ever while you were working, did you ever need to get help?
Only when there are big waves.
Oh, is that right? Yeah, big waves. Whoops, stomach issues.
Yeah.
There was a doctor on board, though.
Yeah,
right?
a doctor and a nurse.
Okay, because shortly after I got out of medical school, I applied to be a ship's doctor.
That's awesome.
Well, no, because I was denied. For some reason, they didn't give me the job.
Oh, I'm sorry.
Well, it is, to me, it's interesting because everybody remembers the Love Boat and all of this stuff. But in actual fact, I guess the medical people on a cruise ship, they have to be pretty well grounded because there's any number of things can happen. And particularly when you're far away, you have to be pretty creative. Is it like a little hospital?
Yeah. No, they have almost everything there. Of course, when they break a leg or something like that, then of course they will go to next port and then in the next hospital. Sure, it could be that we are the ship is on sea 5 or 6 days, and then there are more older people, and you have
let me ask you this, because I know that a lot of people out there are thinking about that. That's cool, learning about these things. Did you pretty much live on the ship?
Oh yeah, of course.
I don't mean just when you're traveling. I mean when the ship in between cruises.
Yeah. So the whole time.
Did you say that you were on a ship that went around the world? How long was that cruise?
5.5 months.
Yeah. So you were on the ship the whole time.
24 hours.
And how many around the world trips did you do in a row? Did you do that for like a couple of years?
No, only half a year on the big cruise ship. So I saw
one time around the world.
So I saw a lot of countries and continents. And then the river cruise ship was only on a Rhone and Saône in French.
But still, what I'm trying to get at is that you become like a family. That you're on a ship. Were there were the other workers also living aboard ship?
Yeah. So of course, that was my family for that time.
Yeah, I guess.
Yeah, you have to share everything with them.
Okay, let's talk about health and what brought you. We all talk on this program about some things are hereditary, and we're going to get into that with Sylvia, Doc. But mainly, when somebody gets to a point where maybe your work was impacted, you said off the air, we talked a little bit about the thing that drove you to seek treatment was pain.
That's true, yeah.
What about the cosmetic side of what Doc does? Spider veins and things like that. Had you had that sort of work done?
I have that also on my legs, but I never have that done, no. Not really. So I was in a cosmetic studio in Germany, but it didn't work.
Yeah, and by the way, it's interesting, Doc, when she said, when I meant done, I meant in a different way. I mean, had you ever had any kind of treatment? Are there, I mean, I know that there's a lot of people that strictly in the cosmetic business. Shouldn't a patient, though, or a person be kind of aware that there's certain things that you can and cannot do cosmetically for stuff like veins?
Yeah, well, that's true. And I think, there's a lot of people, a lot of different practitioners out there of all sorts that are, kind of advertising themselves as people who are, physicians or practitioners that can take care of those problems. But, I guess I'm a little biased, but I think the best place is to go to an office, a clinic like ours, because we can handle all aspects of vein disease, not only spider veins, but figure out whether it's a part of a bigger picture, which it was for Sylvia. Yes, so I wanted to ask you, Sylvia, pain was your primary symptom,
Yeah,
right?
stabbing pain.
And how long had you been having pain before you decided to look into that pain? Because that's something that we talk a lot about.
Yeah, a lot.
And like Mike said before, pain can sometimes be a good thing because it often is an indication that there is something an underlying issue that needs to be addressed. And a lot of people can ignore pain for a very long period of time.
Yeah, did you, Sylvia? Did you just think, well, it'll go away, or before you actually? And by the way, folks, you go to veinclinicsofhawaii.com because that's where we want you to go. But when we were talking to Sylvia off the air, it was the www that got us connected. So more and more people are going to their computers and saying, I have a sore leg, or I have this, or I have that. What did you do? What sort of pain was it? Sharp pain, aching pain? Did it make you not want to work? What kind of pain was it?
It was a pressure pain on my leg, and next to my kneecap it was a stabbing pain, and it started slowly. I love running, so at first I thought, maybe I run a little bit too much. So at first I thought I didn't think that it was this problem. But of course, because of my years, I'm standing the whole time. I had always the feeling, I have to sit now. I can't stand the 8 hours. I feel so uncomfortable.
So it was actually impacting your ability to work.
Yeah.
And how long had that been going on before you came in to see us?
3-4 months. So it started slowly at the beginning of the year, and then I saw also the big blue vein, and the pain started to get more worse. So, and then I thought, okay, I have to go.
Wow!
somewhere.
What I think is amazing, and you can ask Sylvia, is that the thought was, this is the pain. If you see this, oh my goodness, did the actual area of the protruding vein, or did it actually hurt to the touch?
Did it hurt when?
Yeah, when you touched it, did it hurt, or what?
It always came, and then it was gone again, and then a few minutes later it came again. So it was weird.
How long were you having just the pain before you started developing the dilated vein, the varicose vein? How long was that period?
3-4 months, but it wasn't strong at the beginning.
Yeah, it was gradually increasing. Okay, so when you first started having pain, it didn't occur to you, did it occur to you at all that it might be having to do with your circulation or your veins, even before you developed the dilated vein, and you said, oh gee, this has to do with veins possibly? What was your thought process with respect to what the pain was from? You mentioned running before. Did you were wondering if you maybe exerted yourself too much, or you'd pulled a ligament or whatever? Yeah,
but then it came also when I was sitting on the couch and was like, okay, that can't be from running.
Yeah.
So, and of course my mom has also big issues with her veins. So I thought, okay, maybe she should give it to me too.
Yeah.
Well, she did. So you can call her.
I say, Sylvia, this is funny because I often say, thanks a lot, Mom. Thanks a lot. But I love her, but I didn't need this.
Exactly.
However, the interesting thing is, and with the diagnostics and the stuff the doc's we always talk about, diagnosing the issue and treating it is a lot different in our day than it was, say, in your mom's day or anybody else's day that was used to the old treatment or the old work. Did your mother have any work done on her legs? Did she have?
No. Never.
Just had the issue. Pain?
Yeah, she lived with that. I don't actually know whether she has pain, but you see the veins.
Yeah.
She has ropey kind of bulgy veins. Yeah,
a lot of.
Yeah, and I think the important point there is that even pain is not necessarily something that is going to alarm a person with respect to possibly that being caused by a circulation problem.
Yeah, exactly. That's the part that I'm interested in.
In pain, pain is not the only symptom like that. I mean, there's a whole host of symptoms that is connected with, this thing that we call venous insufficiency, like, muscle cramping or, easy fatigability. You're tired, your legs get tired quicker than they used to, or swelling, or skin discoloration, or even things like restless leg syndrome, which, people never connect with, a vein issue. But so it's a little bit of a hurdle of ours, and we're continuously trying to teach and educate people about symptoms with respect to their legs. But it's usually, unfortunately, not until somebody develops a big bulgy vein that they say, "Oh, yeah, okay, now I know what it is. I've got a vein problem."
Yeah, was that a relief in a way when you finally were able to find out? Okay, I was right. I came to the right place. I'm going to get this treated.
Yeah, it's awesome. So I felt very comfortable there in the office. And I was very happy that they could immediately say, "Oh, here, this is the problem, and this we can do." That was awesome.
Were you as fascinated as I was with ultrasound, with having the ultrasound test?
Yeah. It was pretty cool.
Yeah.
I can't remember. I said, "Oh, there are so many red spots on the display. What is it?"
Yeah.
That's not good. Oh, okay.
Yeah.
But the interesting,
don't ask about that.
But to me, the interesting thing is there's various different ways, and at Vein Clinics of Hawaii, it's different, than in a lot of other places, because it's not just the level of expertise, but the staff and everybody doing work. So let's walk through that. You let your finger do the walking, and you Googled it, right?
That's correct.
Then what happened?
I live in Waikiki, and I wanted to have an office which is very convenient for me and not so far away. And then, I saw also some reviews. They were very good, so I decided to go there.
Okay, and then you started to have the experience that I have. What was the process? You saw it online. You made an appointment, and then went in. And what happened?
Then I got appointment for the ultrasound, went there, and then I already got information about my veins, what happened, or what is the issue, what can we do. Yeah.
Well, before you got to that place, you we put an iPad in your lap, right? Did you have to put a lot of information into an iPad?
Oh, yeah.
Yeah.
And with my
nosy,
limited English,
nosy,
I had to Google everything.
Was that tedious?
Yeah.
We get a lot of complaints about our iPads, but it's kind of a necessary part
of course.
of.
Yeah.
I think it's great. Yeah. And and I think what happens is that the more tools that you have, and the better it can be explained. I want to know, were you relieved to find out that you'd come to the right place, or did you? It wasn't. You're not guessing anymore. You're starting to find out what's going on with you.
Yeah, definitely. I was very happy that somebody can help me with my issue.
And generally, Dr. Julef, at what point in time do you meet the patient for the first time? Once they've gone through the iPad experience, we call it. Yeah. By the way, this is really great, because usually they give you a piece of paper and on a scale of 1 to 10 and do all this. I found it good, because I thought, well, at least when the doctor professional comes in, he's going to have a pretty good picture of me based on all of this question. Didn't take too long, did it?
Oh, not at all. Okay, good. I have to translate some things.
Yeah.
In my case, maybe a little bit longer, but very professional.
I guess we need to get a German version of that iPad. That's what we need.
But Doc, obviously this was done with forethought. This is what you need to know, because the quality time that you can spend with the patient is based on how much do we know about you. So how enlightening is it for you when you get with the iPad? When somebody's taking the trouble to fill it out.
No, it's tremendously beneficial. Because it eliminates all of that time that we would otherwise have to spend asking the patient all those questions. And they put it in, they answer all the questions, and then what gets spit out is a nice little summary of, their past medical history and the medications that they're on, the surgery that they've had, et cetera, et cetera. So, it's, even though it can be a little aggravating for some people, it's very, very beneficial in the long run, and it's added a lot to the way that we process people. But to answer your question, I might see that any one patient at any particular point that they come in. Now, Sylvia, I did not see the very first time that she came in, but I may have. I see many patients that are coming in for the first time. But so they come in for that initial, what we call consultation, and then typically, and as you know, I mean, we use ultrasound extensively to evaluate problems with veins and to look at vein function, and then that's typically the next time that they return. I don't do the ultrasounds. We have a vascular tech who's much better at it than I am, and typically, that's their second visit to the office.
Yeah. I think that's good, because then I would imagine, Sylvia, once you found out that, okay, I'm at the right place, I've had the test. What did Doc tell you? What did they tell you that you had, and how did they explain the treatment options?
In the end, there were not so many options. So they told me right away, we have to do this and that. And for me, it was clear. And I felt very comfortable. Yeah.
Okay, Doc. So let's go back to your memory now. What did you see? What did you determine was what needed to be done to help Sylvia?
Sylvia had, a fairly common problem. I mean, I don't want to say run of the mill, because Sylvia certainly
she wasn't be special. No, you want to be special.
But she had reflux, venous reflux, and for those of our listeners that are brand new today, reflux means that blood is moving in the wrong direction.
Yeah, it's supposed to be going up to the heart instead of falling down to the feet.
Yes, exactly. And when people have that, it's not like all of their veins are doing that. It's specific veins in their legs that often have that problem, and most of the time it involves veins that we can easily manipulate to make the process better.
Okay, in Sylvia's case, was this in one leg? Both legs?
Yeah, in both legs.
Worse in one than the other, or about the same?
So I had one big blue legs they removed on one side, and also...
Yeah, I think one leg was a fair bit worse than the other with respect to the varicose veins, the dilated, the big blue that you said.
And you said, by the way, that this is not uncommon.
No.
Same with me. I have one leg that is, a lot worse than the other.
Actually, that's very common. And even though I think the amount of reflux that you had, Sylvia, in both legs was about equal, but for some reason, and like you say, Mike, we see this all the time, where one leg will be a fair bit worse than the other with respect to the superficial stuff that we see, like the varicose veins and the, dilated veins within the skin. And why that is, I'm not quite sure, but it's very, very common. And if the patient is having symptoms in both legs that can be attributable to their venous reflux, then of course we treat both legs. And I think we did the usual kind of procedures that we typically do to fix that reflux. We do something called endovenous ablation. And endovenous ablation just means that we're closing down that vein that is not functioning properly. The reason that we close it down is because the basic defect is that there are tiny little valves within veins that keep the blood moving in the right direction. And that's what happens when people develop reflux. Those valves start to fail. So rather than the blood continuously moving upward and those valves functioning to make that happen, the valves fail and the blood starts to settle down into the lower leg, and that's what creates symptoms. So the basic defect is the valves. Those valves are tiny, tiny little pieces of tissue. We certainly can't surgically repair them with any reliability.
Working on it.
Right now. We're working on it. But, so the next best thing is to close the vein down, which we do with a little catheter or a laser fiber or, a variety of different things. Sometimes we use glue, that kind of stuff. So,
okay, now, Sylvia, though, here's the thing. Your fears were correct. You went and got diagnosed, and the treatment plan was explained. This is what we need to do for you. Where are you with regards to your treatment so far? That's something we haven't asked. I haven't asked you yet. How long ago was this, and what treatments have you had so far?
So it was for 5 days. We have in 5 days 5 surgeries.
5 procedures.
Sessions, yeah. Then I was at home a little bit. After that, I was wearing my stockings for over a week, and
What month was it? Did you say?
In June.
June, yeah.
End of June.
You're 3 or 4 months post procedure now. How long do you think it took you to sort of heal completely from the procedures?
Not so long. I was pretty impressed that I didn't have so much pain after that.
I mean, I would be pretty upset if I had pain, a lot of pain. Wait a minute, what did I come here for? But that's interesting because that's why I said earlier that pain can be a good thing. It called to your attention to get looked at.
Yeah, I thought at first for removing the vein, there should be pain after that. Of course, you Google that. What can happen after that? But no, I was pretty good. So I felt very good, and I could work after that pretty fast again.
Yeah. How long? When did you go back to work, would you say?
2 days later.
Yeah. Well,
that's another thing that, by the way, back in the day, and I'm sure you explained this, that the procedures that I've had, and certainly the procedures that you had, used to be sometimes a hospital experience and sometimes a lot more painful because it was just a bigger deal.
Yeah. And I was going to mention that before. The procedure that we do today to fix the refluxing vein, we close the vein down, but that took the place of surgical vein stripping,
cutting the leg open, taking the vein out. Ouch.
Yeah, right. Which is rather than just closing the vein down and leaving it in the leg, we actually ripped the vein out of the leg. And people were in the hospital 2 or 3 days. There was a lot of bleeding and bruising and the incisions, and it wasn't a very pleasant experience for most people.
I'm interested, though. One of the things you said is when you got back to work, the pain was less of an issue. Is it gone?
Yeah.
This is really important.
I don't have any pain anymore.
Yeah, I mean, that in itself is a home run, Doc, right? I mean, you base, the success of any procedure, did it do the right thing? Did it remove or eliminate or certainly reduce the pain?
Yeah. Absolutely. And discomfort, pain, achiness, there's a variety of different words that we use for that. But, the achiness that comes along with venous insufficiency, the heaviness, a lot of people feel like their leg is heavy.
Yeah, I don't feel that either anymore.
Did you have that before?
Yeah. When I was standing, it was always like this.
So, achiness, heaviness, and fatigue are probably the 3 most reliably eliminated symptoms from these procedures. But it also does a very good job with eliminating some of the other things that we talked about, like cramping, restless legs, swelling, etc.
Yeah, that's the other point I was trying to make. And, earlier you said that first of all, I don't like running, okay? Like it's like poison. But I know that there's some people that like running because it feels good to get that engine going and everything else. Have you been able to run since your surgery?
Yeah.
How's that doing?
It's awesome. I love it.
Do you feel like you had an improvement in your stamina or strength or anything like that after you had the procedures done? Stamina, were you able to run longer, or did you feel like your legs had more energy? for instance?
Yeah, more energy, and that I don't need to concentrate off my legs because I was always concentrating. Okay, now the pain is back, so
Yeah. See, that's what I was really asking about. Because let's say typically, if you're going to go for a run today, how far is it going to be? A couple miles, 3 miles, 2 miles? How far?
5, 6.
Yeah. Okay. So,
Yeah.
were there times did you either had to cut your run?
Of course, I walked
time,
a lot.
or slow down, or walk, or even sit down.
Yeah.
You know?
Yeah.
And so obviously you were able to determine, hey, whatever I got, it's not going away. And so I'm not going to put up with this. I don't want this anymore. I want to be able to run and not hurt. So now this seems to be one of the benefits of the surgery already is that you can run again.
Yeah.
And we hear that a lot.
Yeah,
too.
that's right. I'm the same way.
You know, especially some of the older patients that we have.
He's being nice. He's talking about me.
No, I was not. You know, they come in and that's one of their complaints. And that's a big problem because they're having symptoms that are interfering with not only activities that they want to do, but the activities that they should be doing. You know, a lot of people come in and say, gee, doc, I can't go to the gym anymore. I can't go out and walk the couple miles that I used to every day. So not only are you eliminating the symptoms that they're having, but you're also hopefully getting them back on track to have a much more healthier life and higher quality of life.
Well, that's the thing, Sylvia. I wanted to know, and I think that the audience wants to know. At one point in time, were you ever worried that this might affect your ability to work because you're standing up for a living, and if your legs are sore, either would you be not spending enough time thinking about the job and thinking about the pain? Was that a concern as well?
Sylvia's German, so she would have gone to work anyway, right?
That's true. But of course, you're thinking about to have a job where you're most sitting can sit. Yeah, of course. You have the thoughts.
Yeah, get off your feet.
And we have an awful lot of professional people out there that are they're hairstylists, there's doc dentists, there's everybody that stands up, and I would imagine that part of what you do not only was the standing up, but was dealing with people, and you have to feel pretty good to deal with people, right? With some of the problems that come up at work.
Yeah, of course.
Yeah, with respect to the risk factors of the risk for developing venous disease, Sylvia's got two big ones. First is genetics. Your mother had varicose veins. Yeah, and then also a profession where you're on your feet, and that really does make a huge difference. Most of our patients either have jobs or had jobs for much of their life where they were on their feet all day long. So those are probably the two highest. In addition to pregnancies, that increases your risk. But those are the two big ones.
That being said, so what you're saying is it's measurably different the way you feel at work. Is it even a thought anymore? Are you past this pain? And then what are you going to be doing to make sure that it doesn't come back? What sort of monitoring do you intend to do to be active in making sure that you stay healthy?
So, of course, I do sports, and if I would feel any pain, of course, I would go back to the office to check that.
What are you doing at work to help it not come back?
To wearing the stockings.
Very good,
oh,
Sylvia.
Boy, you know what?
You.
Doc, he said that. He came in right on cue. I am the same way. Now, are you wearing the knee length, the thigh length? What are you wearing?
The long one.
Yeah.
Oh, really? Are you wearing thigh-high stockings?
Yeah.
Okay. Because you don't necessarily need to at this point. Usually, most of our patients, I advise them that they can go to a knee-high stocking for long-term use, and really especially for people who are on their feet all day long. Even after they've had procedures to fix the reflux, they definitely should stay on some sort of compression stocking, even if it's just at work, and it will help you kind of number one, not have symptoms. Number two, hopefully prevent things from coming back.
Okay, let's be honest to the doc, because I am when we talk. Do you have any problems with the stockings? Do you have any issues getting them on or taking them off?
No, not at all. You get the little
gloves.
No,
Did you get that round roller thing?
The paper one what you put on your feet.
On your foot, yeah.
Yeah, and then
that helps you get the stocking.
it's so much easier.
Oh, yeah.
It's
Yeah.
so good.
Yeah.
Is that something I don't know about? That's something new?
Well, actually, Mike's got a little different technique that is very, very good.
Yeah.
I just saw you just showed me a few
Yeah,
weeks ago, and it's the first time I'd ever seen it, and that works. But yeah, having a little. A plastic bag. Is that what you mean? Plastic bag?
Yeah.
A little bag you put over the front of your foot and hopefully over your heel.
Right.
You get that stocking up over your foot and heel, which is the biggest part.
Now,
the heel.
do you wear the ones that don't have the toes, or do you wear the ones that are the full foot?
No. It's cutted.
Yeah, cutted it. Yeah, it is. And I want to tell you, gang, the reason why we're talking about this is because I fought kicking and screaming about this thing. And I think it's because the first compression garment that I was wearing, the compression was more than the one I am wearing. Mm-hmm. And if I could wear that every day, I would, but I can't. So the ones that I'm wearing now, which is the one that you recommended, it's not unpleasant. It doesn't hurt at the end of the day. How long do you wear them every day?
So when I wake
Tell
up...
the truth now. We're watching you.
Yes.
We're paying
Sylvia,
attention.
tell the truth.
Yeah, so when I wake up, I do my run without it. I feel better without it.
Yeah.
But when I go to work, I wear it.
Yeah. And for about how many hours a day would you be wearing that compression garment?
9, 10.
Oh, that's a long time. Yeah. That's pretty good.
Yeah, and with respect to what you mentioned before, Mike, about finding the stocking that is the most comfortable, that's important. Because if the stocking is too tight and patients aren't going to wear it because of that, then it's not doing them any good.
By the way, Sylvia, you like this, and the reason why is because I look forward to maybe seeing you one day at the office because I'm there often. But there was this one guy in there a couple months ago. And he's a big guy like me, and he was sitting there with his stockings on, and he sort of smiled because I was getting a new pair of stockings. I was opening up the bag to look at him, and we sort of looked at each other, and we became sort of brothers for a moment because here we are in the
Stocking
office.
brothers.
And I said, now, do you wear those every day? Tell the truth. And he had to say no, but once you've done it, I was reluctant. I don't know if you ever fought against it or pushed back against it, but now it's just part of my day. I just wear them, and it makes me feel better.
Yeah, it's like a day routine.
Yeah, that's good. And Doc, you've often said this, is that sometimes it's like you're reinventing the wheel. If you don't do it all the time, you're really ignoring the benefits it'll provide you.
Yeah. And you're taking one step forward and three steps back. So because you really do lose some ground when you stop wearing your stockings, especially if you have long-standing vein problems and chronic swelling. Sylvia doesn't have that, at the moment. If you're someone who has that swelling and skin problems, it's so important to keep the swelling to a minimum, and the only way you're going to do that is by wearing stockings.
Well, here's the other interesting thing, Sylvia. I don't know how much research you went and did because you apparently did a lot, but I was amazed and I'm constantly amazed at how bad it gets for some people. When you see the different stages of venous insufficiency and you see how it gets, there's 6 different categories of it. When it gets up to the top category with skin issues and everything else, it's kind of scary. So it must mean that you have confronted this at the best time you can.
Yeah.
Are you going to be a little watchful on this? Keep an eye on it?
Oh, of course,
Yeah,
of course. I love to wear dresses, so of course
Yeah,
I would
yeah,
do that.
yeah.
I'm very happy that, I found a doctor very quick that he could help me.
Have you ever shared any of this with friends and coworkers and things?
With coworkers, exactly.
Yeah.
I have one other girl. She's always moving and restless when she's standing, and I also told her, hey, I think you have to go there.
Yeah, and I'm the same way. And unfortunately, and if I were the doc, it'd be awful because every now and again I'll see somebody displaying the symptoms that I used to have. And some of them were visual. I had, discoloration, a lot of things. and I almost want to go up to him and say, you know what, you need to go see my doctor. Why are you putting up with that? Isn't it because most of us, it comes on so slowly, Doc? That isn't that one of the biggest problems of vein disease? It just creeps in there for so slowly, and pretty soon you're a wreck.
Yeah. That is one of the hurdles because it comes on so slowly, and over such a long period of time that people tend to just put up with it, or they attribute it to other things like, oh, I'm just getting old, or my knees are bad, or whatever. But so it all goes back to that idea that there's so many symptoms and problems that go along with venous insufficiency and vein disease that are not obviously obvious that they're connected with vein problems, and we're just trying to teach people about all those. Yeah,
and symptoms. I think what's important, gang, because of Sylvia's willingness to share her time with us today, and that is, there are a lot of different symptoms that people will say. They have tingling, they have burning, they have itching, they have swelling, they have these different things. In your case, it was pain.
And swelling.
Yeah. Okay. We haven't even talked about the swelling part yet. So, did you associate the pain and the swelling together, or did you think there are two different things maybe?
At the beginning, I thought it's different because when I stand the whole time and then you have your socks on, and then in the evening you remove your socks and you see the end of the socks in your skin.
The band,
yeah.
Okay, so is that what you were seeing? You would wear socks during the day, and then you got home at night and you took your socks off. You saw the indentation.
Yeah.
How long had that been going on? Would you say?
About years.
Yeah.
A long time.
Yeah, long time.
Has most of that gone away?
Yeah.
Okay, good.
Yeah, that's very important because you see that, and I've seen it online now. Sometimes it just pops up and it says, this is a sign of something not so good. Why is that?
With swelling?
Yeah.
Well, because...
I mean the indentations. That you get.
Well, yeah, because that is the if you don't have some constriction to your leg, lower leg and ankle, then often you can have a fair amount of swelling, edema, excess fluid in your leg, and you don't really know it because you're not. There's no contrast, Now,
but if you take your sock off, and there's this ring around your leg, which is an indentation, say, what's that all about?
Yeah, so if you wear a tightish kind of low sock, and then at the end of the day you take it off and you see an indentation, you see maybe your ankle a little more defined, that's an indication that you're accumulating fluid or edema in the lower part of your leg, and that can definitely be a symptom of venous insufficiency, which for Sylvia it sounds like it was, if it has resolved pretty completely at this point.
Yeah, and once again, so that people can differentiate. And by the way, you need to go to veinclinicsofhawaii.com and make an appointment. It's simple. veinclinicsofhawaii.com. And no matter what island you're on, we'll get to you. But I think that the other thing is, once again, to really narrow down and define the pain. Did you say sometimes it was a sharp pain, or it was a dull pain, or did it manifest different ways at different times? How many different kinds of pain was it?
So it was a stabbing pain next to the kneecap, and then was a pressure pain on my leg. So it was always the same, on the same position. Yeah, it was so annoying.
Yeah, and it's kind of neat because she's staying so annoying. She actually got angry, right? You got mad at yourself.
Yeah, because I thought, oh my gosh, I can't run anymore.
Yeah, but what I'm more keen about is that, medicine in general is keeping us alive a lot longer. And that means a lot of us that had, say, intentions of retiring at a certain age are working way past that now because of either financial need or because they want to. They got the energy they want to. I'm worried that there are people out there listening like you that maybe would have not been able to do their job as well had they not looked into getting this looked at and treated. With regards to your own self. I mean, was the reason you picked up the mouse and went Googling to find out was that it was bothering you at work to the point where you were thinking, can I still do this? I mean, exactly. How bad was it?
Yeah, it was pretty bad. It wasn't there the whole time, but especially when it's pretty important. You have to stand, there are guests in front of you, you have to work, and then you feel the pain. It's bothering you totally, and you don't, you want to fix it.
Yeah, and I think, especially in a situation like Sylvia's where, it was impacting her ability to do her job, in a comfortable and pleasant sort of fashion. And that is only going to get worse with time. I think that's the other thing about venous disease is, unlike arterial disease or other, medical kind of problems, there aren't a lot of things that you can do to reverse the process. With venous disease, it just slowly gets worse and worse with time. It's not like you can exercise more and it's going to go away, or take a medication and it's going to go away. It's just going to get worse with time. And it's one of the reasons that we treat it, because it will get worse with time. And another one of the reasons why it's probably a little better to treat her earlier than later, because often the remedy is a fair bit simpler, as opposed to waiting 10 years and fixing it then.
Typically, when you're talking about a work day, just to remind everybody, Sylvia's in the hospitality business. She's worked on cruise ships, working on land now, but she's down in the hotel situation. What sort of issues do you handle at work? What's when you interact with the guests? What sort of things do you deal with?
I'm a supervisor at the front desk, so I will I check in guests, I check out guests, and if there are any problems, I will help and find a solution.
And I'm going to imagine sometimes, because I know we've done this on our Tourism Tuesday show, that sometimes when a guest gets to the hotel from the airport, they're full of angry because it's hot. Somebody lost my bag. What do you mean this? So you actually have to have, in addition to skills, you have to have a pretty good attitude, right? To be able to do that.
Yeah, I do that over 12, 13 years now.
Yeah.
But of course,
that'd be a great. She should write a great book.
If your legs are paining you, it's more difficult.
You bet.
To maintain that pleasant personality.
Well,
you have to be a professional. Yeah.
Well, obviously, and I've heard this said many, many times in the hospitality industry, in the hotels, your doorman, your concierge, your front desk people, that's the first person you see when you get to that hotel.
Yeah.
And so if that person's all grumpy because their legs hurt,
exactly.
That's a great thing. I think, Doc, that's got to be very reassuring to the different kinds of patients and the different reasons why people will try to find out what's going on with me, man. This is not working.
The symptoms can come on in a variety of different places, and I think work is probably one of those big things. Because when symptoms do interfere with a person's ability to do their job, like you alluded to before, it becomes a threatening sort of issue, because if you can't work, and people are having to work longer than they were before, there's no question about that. Venous problems are something that worsen with or become more frequent with age.
Okay, well, when you first decided to get to Google and ask our big friend Google what's going on, typically speaking, you're at work for 12 hours, 13 hours at a time?
No, I only work 8 hours.
8 hours.
Yeah.
And so at what point in time was the symptoms starting to bother you? I mean, after 3 hours, after 4 hours, or maybe earlier than that? I don't know.
Yeah, also earlier, before work already.
Wow.
So it started in the morning when I was running, and then it came, then it was gone, and then it came again. But the whole day. Yeah.
Did you ever think, I better go for a run, I'll feel better? I mean, some people say right now, I bet you when you go for a run because you want to, right? It makes you feel good.
Yeah.
Okay. Did you think that maybe running would cure the pain or did you start to realize it maybe not curing it, maybe it's causing it?
At the beginning I thought it's the reason why I have the pain, so I stopped running. But then when I realized when I was sitting that I had the same pain, I was like, okay, then I can also run. It doesn't matter.
Yeah. I think, Doc, aren't you not surprised, but amazed at how many different things people will actually compromise because they just don't get it. That it's, there's something wrong here. How many symptoms do you need? That's why I said I wasn't trying to be facetious when I said pain is good.
Mm-hmm.
Because same thing happened to me,
right.
Sylvia. I mean, without the pain, I wouldn't have known. I didn't look. I didn't, But now I look. Now I don't want the pain. I don't want the discomfort anymore.
Yeah, and it's even more surprising when we see patients with real advanced forms of venous disease where, they have real bad chronic swelling and the skin discoloration and the skin changes that occur, later on in the process, and even ulcerations. I mean, we've talked about that before.
Yeah.
People can sort of, ignore for a little while and then start to do their home remedies on, ulcers, and that can go on for months and sometimes even years before they, feel the need to kind of, go to our big brother Google.
And just out of curiosity, have you your big brother Google? That's the way it is.
No.
Who even used the word? I mean, here we all speak Google. That's a silly word, isn't it?
Yeah.
I mean, it sounds like something that somebody threw up, that somebody Googled on me. But it is a miracle thing. But isn't it also a concern if you believe in it too much? I mean, you got guidance, right? But then when you go to an office, then you learn some of the other things. So obviously people are going to say to you, or you're going to say to people, if you notice them looking like they're experiencing the symptoms that you used to have, and like you've already done, you got to go see doctor. You got to go see the vein clinics.
Exactly, yeah.
That's the fun part. Isn't it?
Google can be a double-edged sword.
Yeah.
I always say that when we get good reviews, then Google knows everything. When we get bad reviews, then
Google
it doesn't
knows
know anything. But I kind of like people to research the whole topic before they come in, so that they have a little bit of knowledge, because then we can usually build on that. And so I'm never unhappy that people have kind of looked into the topic and learned what they could about what they have, and I don't think most people are going to have some misconceptions, but we can have a little more knowledgeable conversation if we have done that.
We actually talked, and before we wind up today, Sylvia, we actually talked that you had actually gone to a cosmetic place to take a look at spider veins. And obviously there's a difference between a spider vein, which is, if you want to get spider veins, that's elective. It's something you have to pay for. And then on the other side of it, your health coverage, I'm sure, came in and helped you with the vein problem that you had and the pain you have. Had you since then looked at cosmetic stuff?
Not yet.
Yeah. Doesn't sound like you really need it either, but you like to wear dresses and all that stuff. But would you be more likely to say, and Doc, you can explain this. I shouldn't ask Sylvia. I should ask you this. Just because you have spider veins and cosmetic issues does not mean that you're going to need vein surgery.
No, it doesn't.
Yeah. That's pretty interesting.
But people who, there's a certain number of people who do have just spider veins. Yeah. It doesn't mean that they do not have venous insufficiency. They might, so that can be one of the warning signs of, an underlying functional problem with veins.
Yeah, I think that, and that's why, and every chance that we get to have somebody join us that is a patient, it just shows the group. And I don't know if you've even done this, Sylvia, but I talk to other patients, in the waiting room and stuff. What brought you here? What did you? Have you done that? Have you talked to anybody else at the office? A patient while you're waiting for treatment or waiting to get your ultrasound or waiting for anything?
In the waiting room?
Yeah.
No.
Yeah. See, I do that. I go talk to the other. What are you?
No,
what
the
are you
German
doing
people, they are more quiet.
Yeah. Yeah. Well, I tell you what, it's not a matter of quietness. It's a matter of, we are so happy that you joined us, because these are the fun shows that we do. It's one thing to talk about the clinical nature of what the clinics do, but when we actually have people that have home runs, that must mean a big pat on the back, Doc, for your staff. I mean, look at the job they do.
It's fun to talk to patients, especially if they're happy. Yeah. Because it kind of brings it all home and makes it so much more worthwhile. Makes us happy. Makes us happy.
Yeah. And by the way, when that pain can go away, On a scale of 1 to 10, I'm sure you got assets in your little thing. What was the pain? A 5 all the time? Was it? Did it sometimes? You said sometimes it was stabbing.
Yeah.
Now that it's gone, do you even remember it?
A little bit, but I'm happy that it's not there anymore.
Yeah, you bet. Thank you so much for joining us. We appreciate it. And Doc, that does it for this time. We'll see you next time. And everybody else, if you like what you heard, tell everybody else about it. We'll be back next week with another new show. In the meantime, go to veinclinicsofhawaii.com. That's veinclinicsofhawaii.com, and get yourself into the deal. Find out what's going on with you, and more importantly, what you can do to get it fixed. veinclinicsofhawaii.com.
Well, that's our program for today, and we certainly hope you enjoyed meeting us. Please come back next week for our next episode. And in the meanwhile, to learn more, please visit our interactive website, veinclinicsofhawaii.com. That's veinclinicsofhawaii.com.